good morning, and welcome. We're really excited to be joined by the Community Health Synergy, a queer-owned national consulting firm dedicated to advancing health equity through community-centered capacity building. We're joined this morning by Jolie, Jerry McGee Tyner, and Joanne Lee. Community Health Synergy is providing community-centered capacity building services to the LGBTQ TA Center focused on Medi-Cal, sustainability, strategic planning, and capacity building for 6 California-based prevention and early intervention program grantees. This work is really important because it strengthens our long-term sustainability and the impact of LGBTQ-focused prevention and early intervention programs. So I want to share just a few housekeeping items. You will have the opportunity to engage in the chat, to ask questions, to even unmute in this feature, and there'll be dedicated times throughout that Jerry has allotted to conversation. And then the other thing that I want to share is that we're not recording. We will be sending the slides out in a follow-up email though. So with that said, I hand it over to Joe.
Thank you so much, Oriana. Hello, everyone. Good morning. It's so great to see those who are on camera. It's nice to see faces. And if you're able to join us on camera, we highly welcome you too. But if you're in a position or in a place where you are unable to turn on your camera, that is completely understandable. We'd love to hear from the audience today. If you can drop in a chat box and introduce yourself, I'll provide a prompt. If you can provide your name, pronouns, and organization. As Oriana has mentioned, my name is Jolie. I use he and him pronouns. I'm currently in a shared working space, so if you hear background noises, I apologize for the background noises in advance. As Oriana has have mentioned, Community Health Synergy, I serve as the founder and principal consultant of Community Health Synergy. We provide a lot of community-centered capacity building services for nonprofit organizations, state government agencies, managed care plans, and philanthropy organizations across the country. And I've been in this field for over 15 years, working in various sectors that touch on health equity work. And we are really, truly honored to be partnering with the LGBTQ TA Center to really provide direct support for these 6 California-based LGBTQ prevention and early intervention program grantees. The core focus of our work is to ensure the sustainability of your critical services for to continuously serve LGBTQ plus populations, and ensuring that we advance health equity for LGBTQ plus populations. So this is, for me, a very personal mission. And I'm just so, so grateful for the opportunity to do this work and to also learn from everyone on this call today. So these are the grantees that we have the honor of serving and supporting directly. And I see that many are represented here in today's call. San Joaquin Pride Center, hello. Open House, hello. Gender Health Center, this is fabulous. Thank you so much for showing up. If you have colleagues who might benefit from this really fun and engaging Medi-Cal 101 presentation, feel free to ping them now and encourage them to join this call. But this is also being recorded and can be shared. So for today, our learning objectives are fivefold. We are really excited to help describe the public benefits and eligibility requirements for Magi and non-Magi Medi-Cal. And I'm just curious just to understand the level of knowledge and awareness of Medi-Cal eligibility. If folks can please drop in the chat box on a scale of 1 to 5, 1 being unfamiliar and 5 being I'm an expert in Medi-Cal eligibility. It'll be really awesome to get to know what your level of knowledge is. So thank you. I see some numbers trickling in. In this training, we're going to identify enrollment steps. We're going to discuss the changes to the scope of coverage based on citizenship and immigration status, and recognize some of the common issues in accessing public benefits. And most importantly, we're going to understand how specific benefits to meet the health needs of LGBTQ plus populations and the implications of the HR1 bill. So I see their range of knowledge is 1 to 3 in this group. So it sounds like this training is coming at a perfect time. I'm going to hand over to my fabulous and most amazing colleague, Jerry McGee-Tyner. I've worked with her for many years, and I've always learned something new from her in these trainings. I'm going to roll out the red carpet for her. She is the Senior Consultant for Medicaid Strategy, and she is our Medicaid expert. And so uh, brace yourselves for a really fun training ahead. So Jerry, I'll hand it over to you for more introductions and for you to kick off the training. Thank you.
Yes, thank you, Joe. So good morning, everyone. I'm happy to be here this morning presenting to you about Medi-Cal in this training. Thank you all who are represented here for the LGBTQ TA Center. And, you know, I'm considered an expert, but guess what? I'm learning every day too. So, you know, I don't think we ever fully arrive. There's always something to learn, especially now with all these changes coming up. What I say today will really be not true come January. So I'm going to kind of walk you through what Medi-Cal looks like today and what the proposed changes look like starting in January. So let's get ready to roll here. And my sentiment, like Joe mentioned, is dear to my heart, having equitable healthcare and affordable equitable healthcare. And so, you know, so that is why the Medicaid or Medi-Cal program is so very critical for this access. And so we can dive on in. Okay, so Medicaid, I'll just start there because sometimes we hear that word and we're like, what is Medicaid? I know about Medi-Cal, but what is Medicaid? Well, Medicaid is the Medi-Cal program in California. And so I forgot my fun facts this morning, but if you're in other states, it's called other fun things. And if I can pull them up at some point, I would, but some of the states that call their Medicaid, it's like some amazing, they've come up with a lot of amazing names, you know, based on their state. And so, so Medi-Cal, the Cal being for California. So this is a joint federal and state program that helps pay medical costs for people who have limited income and resources. And there are some other eligibility requirements that will also need to be met. Okay, so so Medi-Cal is public health insurance, as opposed to there are some programs that sometimes provide coverage in different counties, but this is actual real insurance for low-income individuals. And so here are the populations: families with children, seniors, persons with disabilities, foster care, and pregnant women. Okay, so applying for benefits. So I think we've been maybe a year, maybe a little over a year now, the system for applying for benefits has changed so that all the counties in California are on one system. So that is called benefitscal.org. And so that's how one would apply for benefits. Well, that's one way anyway. We'll talk about another one. And so what would be important to have available when applying is all the names of the household members, names, date of birth, social security number, work or pay stubs, income taxes. And I'll say a little bit more about that because we know in some counties we have like farm workers or people who may work and don't receive an actual, you know, pay stub, right? They may get paid cash. So there are other methods in a statement of incomes that can be provided to show income. So even if it's zero income, there's an attestation to that. So So whatever the income is, there are options to provide that proof of income. And also, if you're self-employed, then there's taxes, as well as the Medi-Cal expansion. That group is based on household taxes, and we'll talk about that as well. In addition, if if someone is a legal permanent resident, they may have an LPR card, or if you're on a visa, like a tourist visa, a student visa, a work visa. Actually, there's a lot of visas. Whatever visa, you would bring that as well, because there are so many different ones. So in-person assistance is always available at a health and human service agency. There different agencies call themselves different things, but essentially they're all human service agencies. So if one needs help applying online and they need more assistance, maybe to meet the language need, they can also go into their local community health center or some type of resource center that sometimes offer to help those enroll in Medi-Cal in the community. Next slide, please. Okay, so submitting an application through coveredca.com is also an option for applying for Medi-Cal. And this is important because coveredca.com will give you actually real-time temporary Medi-Cal. So it's called accelerated enrollment, where a card could be printed out with an effective date. And basically, you will have coverage immediately to see a doctor, get medications, or address any urgent medical needs. You would have that option right away, only applying through coveredca.com. So it's not applying for Covered California health plans, which that's an option too, but it's an option for both Medi-Cal and Covered California. So sometimes there's a mixed household where maybe the kids are eligible for Medi-Cal because of the income levels, and the parents are eligible for Covered California. So maybe that's the idea. You can have, that type of dual coverage in one household. But even if no one is eligible for Covered California, you can apply for Medi-Cal benefits through this portal. And the Medi-Cal is only received via this enrollment portal. So that's important. I don't want you guys to go, I went to the benefits Cowen, portal, and I didn't get my immediate Medi-Cal. You won't. You have to go through coveredca.com to get the accelerated enrollment. Okay, next slide. So let's talk about what's called MAGI Medi-Cal. So MAGI is the acronym that stands for Modified Adjusted Gross Income. And so back in 2014, I think, when the Affordable Care Act passed. So you might recall, I don't know, I'm dating myself. I don't know how old you guys are, but it was called Obamacare when the Affordable Care Act passed. So that was the term that was used, and basically it referenced Affordable Care Act. It expanded Medi-Cal beyond just certain groups, because the traditional Medi-Cal, you had to be linked to children or pregnant or disabled, and that's it. So Affordable Care Act expanded Medi-Cal to adults who didn't have those other criterias, and it's called the Modified Adjusted Gross Income because it uses the income based on your IRS income tax filing. And so whatever you file as a household, that is what's used for verifying income. Okay, so there are various multiple coverage groups with income limits, and they, based on age and pregnancy status. So all that to say, the 138% FPL, which we'll talk about later, is the federal poverty level. So under MAGI Medi-Cal, your income could go up to 138%. So that's like maybe about 20, it goes up a little bit every year. So I think right now it's like 28,000 for one person a year. So, however, if you were pregnant or in a disabled group or a different population, sometimes the income could be more or less. Okay, so that's what that means when there's different income limits. So there are many exceptions to using the IRS rules for certain households. So in other words, you know, there may be mixed status households where maybe some people have UIS, you know, unsatisfactory immigrant statuses, and maybe the kids have citizenship. So there's different variations that are also taken into consideration when we're looking at the Medi-Cal eligibility. Okay, but the takeaway from this slide, which we'll talk about later, Magi is based on the tax household filing status, and it was only limited to 138% of the FPL. Okay, next slide. So this is where you would find, if you had that question, how do I find my adjusted gross income? Good question. It would be on form 1040, line 11, or the form 1040 SR, line 11. So normally it'll just spell out adjusted gross income, and that's where you will find what your adjusted gross income is. Now, please note, so some people, maybe they don't file taxes or they don't file them on time. That would be me. No, sorry. But if you don't file taxes, you can project your income. Maybe you're self-employed. You can project that, hey, I average about, say, it's 20,000 a year, right? So you can indicate that in the system for income, and basically that'll be the number, the income level that you will have your eligibility based on. So now what happens if it's more than that? Then there's a way to reconcile that later when you have to show the actual proof. Okay, next slide. Okay, so Medi-Cal. So this is the California Medi-Cal card. Now it used to be a blue and white card only, and then they decided to put the lovely California poppies on the card to make it more festive. So that's a copy of the card. And so Medi-Cal groups, the groups that are eligible for Medi-Cal are as follows. This is important because later we're going to talk about non-Medi-Cal groups. So Medi-Cal groups are adult individuals between the age of 19 to 64 with income up to 138% FPL. And this is the variations that I was talking about based on different groups. So if you notice for kids up to 18, the income is higher, 266% FPL. Parents, caretaker relatives, it's lower, 109% FPL. Pregnant women, it's 138% for full scope, but it extends to 139 to 213% for pregnancy related services only when the income is falls within that percentage. And then immigrant individuals, can't talk this morning, for all ages up to 138% FPL. That's currently, okay? And then an annual renewal is required. So that means every year the person will receive a renewal package 60 days before their renewal month, that they have to actually provide all this information again or contest that it's the same, nothing has changed. Okay, so that's required. An annual renewal is required to continue benefits for Medi-Cal every year. Okay, next slide. And there will be an opportunity for questions. So countable earned income. So countable means this is what counts for income to meet the 138% FPL. Okay, so wages and salaries, tips, commissions, profits from self-employment, and then for day laborers, a sworn statement is allowed. So that's important to know that, you know, for farm workers in those counties who have a lot of farm workers, they can do a sworn statement for proof of earned income. Okay, next slide. Countable unearned income. So unearned income for Magi is from these various sources. So you have unemployment. It's unearned. You're not working, but you're receiving an unemployment check. So that's why it's called unearned. So disability, retirement, rental income, annuities, dividend payments, and yes, per capita tribal gaming distribution. So yes, if you go to Reno and have income from your winnings, it counts as unearned income, unfortunately. Okay, next slide. Okay, excluded. Everybody loves to hear about, well, what doesn't count? So there are these specific payments that do not count. So it's important if someone has any of these as income that they do not include that as income when they're getting determined for eligibility. So child support payments, veterans benefits, educational assistance, employment training programs. The federal tax refunds do not count. However, good old state, those do. So please note that if you get a tax return refund from the state, you have to include that as income, but not the federal tax refund. That's excluded. So loans, employment and training. Oh, I already said that. Sorry. Repeating myself. Sponsor income, foster care payments, and any needs-based assistance from agencies. So if there's a community agency that are giving some type of needs-based assistance, maybe a housing voucher or a food voucher, or whatever it is, that does not count towards Magi Medi-Cal. Next slide. It's time for a quiz. So I'm gonna see who's paying attention. So here we go. Magi stands for A, managed account gross income. B, modified adjusted gross income. And C, Make America Give Insurance. And I believe in the chat, you can put your responses. Okay, so 3 people have been been paying attention. So yes, next slide. Yep. Okay, so most of you, yes, it stands for modified adjusted gross income. However, we should make America Give Insurance. No. Okay, next slide. Any questions? Okay, this is a little break before we go on to the next segment. So you can come off mute or put your question in the chat if you would like to have a question about anything that was covered for Magi. I knew that was going to be a question. I could have written it down in advance. So apparently it's just a type of loan that has some type of like agreement. That's what I'm learning. So, because I'd never heard of a bona fide loan. I got a lot of loans, but it's just some type of agreement, loan with repayments that are made on the loan. So hold on, let me see. I can get the official does anyone have any other questions as I give you the official definition of that? But I think I hit it. Okay, so I guess it's kind of like a I don't know why it's mentioned in court, but maybe it's just like a good faith loan. That's what it says, if with good faith. So there you go. Thank you, Min.
Anytime.
Oh, and I said that. Yep. So that's what bona fide loan. So anybody who have any of those, yep. Any other questions about Magi Medi-Cal before we transition to non-Magi? How is FPL? Yep. So thank you, Sylvia, for your question. So the federally poverty level is calculated by the federal government. And I don't know who's calculating it, because basically they're saying that they're setting the bar on how much you can have before they pay, right? Before they, for them to pay Medi-Cal, and the level where they won't pay, basically. So Federal government sets that. It does change yearly every April. So that's important to know. Every April, it does go up a little bit. So that during the Affordable Care Act, like what are we, 10 years, 11 years ago? So that amount used to be 15,000. And now it's like at 27, 28,000. So it is creeping up a little bit, but every year it does go up. The spousal support count as income. I noticed child support is excluded. So that's a good question. Spousal support. You're right. So I'm not sure about spousal support. That's a good question. I hope it doesn't count like the child support, because I feel like that's kind of the same category, you know. So I can find out and let you know, but I'm assuming, and I'm probably right, that it is similar to child support. And you know, this is a great question. You know, not many have spousal support, you know, but maybe that's why it wasn't listed, but it is an excellent question. So I will find out. And thank you, Joe. You put in the
Jerry.
federal poverty level. You had my back there. Thank you.
Yeah. This was a common question. So I remember documenting on how FPL is calculated, and then I did do some fact checking on the side. Spousal support or alimony generally counts as income for Medi-Cal eligibility determination.
Alimony.
California.
Okay. Okay. So I'm going to add that. So yes, alimony counts. So, you know, I mean, back in the day, they'll shake you down for your gold ring. So, you know, they're trying to count, and it was true. You couldn't have possessions and value. You know, they would look, do you own this? Do you have this? Do you have jewelry? So that was terrible times. But yes, to the question, but child support, no. So good. Okay. Any other questions before we move on? Oh, chooses to apply through coverage or immediate coverage is just temp coverage. Well, individuals have to do something. So basically, so that is an excellent question. Sylvia is up today and ready. So Sylvia, when you apply through Covered CA, you get the temporary accelerated enrollment while they process the Medi-Cal application for your county. So they don't want to interrupt some immediate need or urgent care for you or some medications you might need. That card you can use right away. So while your coverage is being, you know, your county is making a disposition on whether you're approved or not, you would have the temporary coverage. So normally it's good for like up to 60 days, like the month you enroll and maybe the month after, because that's how long it should take the county to, you know, make a final decision. Then you'll get a real card in the mail and not the paper one that you print out. So, will individual have to do, so you may have to do some, so maybe they don't have enough, you know, documents that were, maybe all the documents were uploaded. They may have questions, so they will send you a needs letter if something is needed to continue to evaluate the eligibility. But you can use that temporary coverage. It will have a good through date on there, actually. So, and a lot of people don't know this because, you know, Benefits Cal, I get it. Most of the county workers prefer you go through Benefits Cal, but why when you can get real-time eligibility when you go through Cover CA? Do we know if gender affirming care will continue to be covered by Medi-Cal considering the new federal ban? And thank you, James, because we're going to touch on that towards the end. We have all that information and updates for you. So we will definitely, yes, okay, James is up. So we will make sure we touch on that. So any other questions before I jump in to the next? Okay, seeing none, hearing none, we can move to the next slide, please. Okay, non-magi. Okay, so we talked about magi. Now we're doing non-magi. Okay, so certain programs require a share of costs with non-magi. We'll talk about that. And we'll talk about how the share costs work. But this is the population that falls under non-Magi. So just to refresh, Magi is based up to 138 FPL, and it's based on the tax filing status of the household. Okay. Non-Magi is not based on the tax filing status of the household. So it does require an income test, meaning you have to show your proof of income, right? And it's for you may hear it called ABD in the community, which is aged, blind, and disabled. So aged is considered 65 years or older, and they call that group the medically needy. And then there's the medically indigent group, which are Medi-Cal individuals who are resident of a long-term care or skilled nursing facility, and the assets may count. So let's talk about the non-Magi. We can go to the next slide, please. So this slide is going to change, and this is what I'm saying. You're always going to be learning something with Medi-Cal as our government makes changes to the program. So I'm just talking about as of today, what the eligibility is, and then I'm going to talk about what it's going to look like later. Okay. So we're talking about property, non-Magi Medi-Cal property. So historically, an individual who falls in non-Magi could not have more than $2,000 in the bank, right? So it's that, if you had over $2,000, you weren't even eligible to go to the next step to see if you're income eligible. So if you had resources, what they call assets, that were $2,000 or over $2,000, you were not eligible for Medi-Cal. So effective in January 2024, Assembly Bill 133 eliminated resource standards for non-Magi. Now, for Magi, when Affordable Care Act happened, they already had no assets that count. So that was wonderful. They didn't even have to worry about assets. But now, 2024, assets went away for non-Magi as well. So that was a good thing. That's a confetti drop. If you have confetti, visualize it, because who can imagine a senior not being able to save for their burial or a rainy day? Like, that was just like a lot of seniors would like just not put their money in a bank, because they couldn't have show more than $2,000. So now, so this is the change. Thank you. The asset limits are going to be reinstated. So that's terrible. However, so effective January 2026, I'm sorry, is it my eyes or does this keep going blurry? The slide keeps going blurry are we good with the slides? They're clear now, but I didn't know if something was happening with me. Okay.
Apologies, Jerry.
No worries.
I was moving things on my computer screen.
Okay.
That causes the
No, you're
blurriness,
good.
but I'm gonna stop moving my screen around.
Okay. I'm just making sure it wasn't my eyes. I was like, what is happening? Okay. So effective January 2026, the change for the asset elimination is going to return. However, it's going to be set at $130,000 for one person and $65,000 each additional household member, up to 10 members. So the good news is it's not going back to $2,000, right? You can have up to $130,000 in your assets, whether that be checking account, savings, or otherwise. So that's a good thing that they didn't put it all the way back to the 2000. Okay. Okay, so let's go to the next slide. So this is how a share of cost works, and it only applies to non-Magi only. So the way a share of cost is calculated, it is basically an out-of-pocket expense where the individual have to meet their share of costs before Medi-Cal will pay, okay? So the share of cost is to be met within the month for which services are provided. This is not a monthly premium. So for example, for one person who gets Social Security of $1,100. The good old federal government has the maintenance need at $600, which means if you make more than $600, you will have a share of costs. In this scenario, the share cost is $500 for services within that given month that the individual would have to meet before Medi-Cal will pay the remaining. Okay, so I know a question might be, well, who sets the maintenance need? And it hasn't changed probably in 50 years. So advocacy around that would be wonderful because I don't know who can live on $600 a month. Okay, so in example 2, if the individual is in a long-term care facility, same income, $1,100, notice the maintenance need is $35. So minus the $35, the share of cost would be $1,065 for that month. Now you may ask, why is it $35? Well, they figured that, the long-term care is paying rent, they're giving you food, they're, giving you whatever, supplies you need. And so you really just need $35 to live on. It maybe that's for their bingo money. I don't know, but $35 seems a little low, but that's how the share of cost works. Okay. All right. So there is a Hunt versus Kaiser. There was a lawsuit years ago where an individual can use old unpaid medical bills to reduce their current or future share of costs. So this is major, and a lot of people don't know this. So basically, if there are any unpaid medical bills, they can show those to their worker, and the worker will deduct from the dollar amount of the unpaid bill towards the share of costs. So if there was an unpaid bill of, $400 and your share cost was $5, they'll apply that $400 whether you paid the bill or not. Notice it says unpaid, so that your share of cost will be lower. Okay. Next slide, please. All right, non-magi deductions. So when somebody falls in this category, okay, medically needy category, ABD, age, blind, and disabled, and they are working, the following deductions are given. So this is good. $1,700 income, they deduct $20 off the top. It's just the any income deduction. Then they deduct $65 and half of the earned income. So that's good, right? So in this scenario, it would bring us down to $1,615. Oh, I'm sorry. The $807.50. Then if they have Medicare, they will also deduct the Medicare premium. So then the income would be $637.40. So they would go from $1,700 to the net non-exempt income of $637.40. So that's good. They try to qualify you and bring that income down, but verification would have to show like 1040s. If you're self-employed, profit loss statement would be needed, Schedule C. That's for self-employed individuals. But if there is a senior who's working a little part-time job, they will allow, for these deductions. Okay. Next slide. Okay. These are just special programs that they also try to qualify a non-magi person for full scope Medi-Cal. Okay. So these are the acronyms. They call them QUIMBY, SLIMBY, QUIDI, and the 200% working disabled program. They couldn't come up with a name for that one. So all of these programs, essentially, this shows you what the coverage will be. So QUIMBY is important for a senior who has Medicare because it pays for the premium for the Medicare Part A, okay, and Part B. Well, I'm sorry, the Part B is the premium, but they qualify for this program so that they don't have to pay out of pocket for their premium, okay, and copays. And then again, the income between 100 and 200 for Slim B, and Medicare premiums with income is at 200%. So these are just programs that will help bring the income down, basically. So these are good programs to know about for the seniors, if there are any agencies that kind of help seniors with Medi-Cal benefits. Okay, next slide. Ooh. Test time. Medi-Cal has no copays or deductibles for its covered services, but may have a share of costs. Is it true or false? All right, John. Let's see. John may not be right.
I could be wrong.
Yes. Nobody wants to challenge John. Well, John must be an expert. Okay, what's the answer? True. Go, John. John's paying attention. Okay, Medi-Cal has, Medi-Cal has no copays or deductibles for its covered services, but yes, there may be a share of costs. Okay. All right. After the quiz, Philip wants us to go back to the previous slide. Uh-oh. Let's see what Philip has. Previous slide. Okay, yes, Philip. What's your question? Do you just want to see it? Oh. Philip, we are going to send these slides to you. Okay, make sure Philip gets these slides. Okay, so next, let's move forward for the sake of time. You're welcome, Philip. Any questions about non-magi? Okay. Hearing none. Oh,
I have a question.
yes.
I was curious about the new asset limits that'll be reinstated in January 2026.
Yes.
I was wondering, will that include the value of people's homes, or is that just like liquid cash?
First home is exempt. Thank goodness, huh? But if you have rental property, I think one of the slides showed rental income would count. And they kind of do an evaluation on the value of the home. That's the rental. So, but your home that you live in, the car that you drive, the first car, right, are exempt.
Thank you.
Yes. Okay. Great question. Okay, next slide, please. These are just all the full scope Medi-Cal benefits. It's comprehensive. When Affordable Care Act passed, we were provided with essential, like every insurance had to provide essential health benefits and comprehensive benefits. So as you can see, it's everything on here, right? In addition to some others that we'll talk about quickly as I speak quickly. So outpatient, ambulatory, emergency, hospitalization, maternity, mental health, behavioral health, prescriptions, dental, physical therapy, occupational therapy, rehab, preventative and wellness services, chronic disease management, children's services, vision. So all of it, you hear everything is comprehensive when you have full scope Medi-Cal benefits. Okay, next slide. Now, as opposed to limited or restricted, which is coming back next year. Limited means that your eligibility will only say, hey, this person's only eligible for pregnancy-related services, or this person's only eligible for emergency-related services, right? Or it'll say, this person, we're only paying for long-term care services. So it will actually limit the what services. And normally this is based on having a satisfactory immigration status. If you do or don't, the benefits will change. Okay, next slide. So satisfactory immigration statuses, these are the ones that are currently considered satisfactory immigration statuses. Okay, lawful permanent residents, refugees, Cuban, Haitian entrants, parolees admitted with a period of parole over 1 year, asylees, victim of trafficking. So all of these are just types of immigration statuses, whether they've come in on a visa or, all these various, they all have a certain type of visas card. visa cards or statuses. Okay, so these are what they call satisfactory immigrant statuses. Okay, next slide. Oh, another quiz. Did I talk about this? I don't even know if I talked about this yet. So maybe you just need to go on a hunch. I think it's this, I don't know. Anyway, all children and adults, maybe I did, are eligible for Medi-Cal benefits, regardless of their citizenship status. Now, this is a trick question, kind of. But is it true, John, or false? Let's see. Or people are like, I don't know. That's kind of a good answer too. Okay, do we have any responses? Let's see. All children, but not all adults. Somebody's been doing homework. I don't think so. Okay, let's see. Well, let me read it again. All children and adults are eligible for Medi-Cal benefits regardless of their citizenship status. Let's see what the answer is. Boom. As of today, if somebody walks in to apply for Medi-Cal benefits, they will get Medi-Cal provided they're eligible, right? Income and so forth. They are eligible regardless of their citizenship status. So that's true. Now, come January, that's going to change. Okay. But today is true. Okay. Regardless of citizenship. Okay. So thank you for that. Well, maybe we should skip this part of the questions and we'll, after a couple of more slides. So California approved Medicaid expansion to childless, non-disabled adults, right? This is under the Affordable Care Act, 19 to 64 under 138%, right? However, here are all the different Senate bills and Assembly bills that gave eligibility to undocumented or those with unsatisfactory immigrant statuses. These are they, okay? So kids were eligible a long time ago. That was in 2016. And then they did the young adults and then the seniors or the aged 50 and over. Then they did everybody, 26 to 49. So this was wonderful. Everybody had it coverage regardless of citizenship, as long as the income was up to 138%. And this was a wonderful thing under, Medi-Cal expansion to all of these groups. However, some of you know these are going to change effective January. Okay, next slide. I'm going to breeze through healthcare options. So basically, healthcare options is when one gets enrolled in Medi-Cal, they have to enroll in a managed care plan, which is mandatory for these different, for the Medi-Cal expansion, okay? Magi Medi-Cal group is mandatory. So beneficiary would call this number and they would be able to select a managed care plan for the county that they reside in of their choice. If it's Alameda County, you only have 2 choices, but other counties may have more than 1 choice, okay? This is what's required to enroll in a Medi-Cal managed care plan. Next slide. Okay, eligibility terminology, I just wanted to touch on or provide for you. You can review this when we send the slides, but these are some of the words that are out there that we just wanted you to be aware of because sometimes, we walk around with acronyms. I know if my kids, they acronym me all day. I'm like, speak English. Tell me what does that mean? Because it's so many acronyms for everything now. But this is what what some of them are when you are speaking in the world of eligibility. Okay. One of the ones that's a hot topic now is the UIS. Okay. Unsatisfactory immigrant status. That is one that you're going to hear a lot in the coming months. Okay. Next slide. So of course you guys are the community partners who are the trusted resources. You're attending this wonderful training today and hopefully learning something, passing those quizzes. So we want to say that our role in the community, when you support our vulnerable populations who are eligible for Medi-Cal, is very important. Most of the time, the community, they're relying on trusted resources for all the information, right? To make sure that they understand eligibility guidelines, whether they're eligible or not, and so forth, okay? It is important to know that there is a document called an authorized representative document. You can use this for a family member as well, okay? What it will do, it will give you the authority and permission to contact your human services agency to speak on the behalf of somebody who needs help with their benefits. So maybe they need help with a renewal. Maybe they want to know, why is my case pending? Maybe they just have a language barrier. They need to authorize you to kind of call the human services agency and ask questions for them. People don't know in the community that you can have access to this document that will help you help somebody else, okay? So these are just some of the, different, as trusted resources, what usually a trusted resource has. So attending trainings like this, you can refer to resources, you can answer questions about eligibility enrollment, or the application process. So this is just important for you to know that our roles in the community are very important. Next slide. So I looked up, now your human service agencies for the various counties may have different sites, but I tried to provide some guidance for you on some phone numbers where you can get a lot of information about applying for Medi-Cal, the case status, request verification letters. Sometimes there are programs that you know about and they need a verification that someone is on CalFresh or that somebody's on Medi-Cal. So you can request those from your human services agencies, and benefit amounts, or whether the Medi-Cal was limited or, full scope. So these are some of the phone numbers that I looked up so that you can have. Next slide. So I don't like to talk about the yucky changes that are coming along, but they are, okay? Reality is reality. We're facing a lot of challenges right now. And so these are the changes, but don't shoot the messenger, because it's just terrible. All of this is a way to kick people off Medi-Cal, right? So it's important that we're able to help people get on and stay on, and, so that they won't, if they're truly eligible, right? I say that for the UIS population, where they're going to do a freeze come January 2026. So that means if you have not applied for Medi-Cal before or by December 31st, you will not be able to apply in January for full scope Medi-Cal benefits if you are a UIS, okay? So we're trying to get as many people enrolled under the current rules as possible so that they will have coverage full scope Medi-Cal in 2026, okay? Also, it's important, if we are able to accomplish that, and get people on Medi-Cal coverage by December 31st, then we also need to help them stay on, because they have a rule that if they fall off and don't complete their renewal, they only have 90 days to do it. And if they don't do it within the 90 days, then they're off for good. Okay. So there's just all these different rules that, UIS Medi-Cal beneficiaries will have to go through. So after January, if a new UIS person walks into a human service agency, they will be only eligible for limited scope or emergency services only. Okay. And so these are the other harms that are going to be done. They're ending dental coverage for UIS. They're reinstating the asset test. We talked about that. 2027, look at the $100 monthly premiums. Okay. So there's just work requirements are coming up. 6 months renewals are coming up. So there's just a lot of changes. So it's going to be important that you have me back so I can explain all this stuff next year, because it's going to look different from the slides that we presented today. Okay, next slide. Okay, I'm going to turn it over to Joe, and he's going to wrap this up. And then if there are any last minute questions, I'm happy to ask. And I will share my contact information so you can call me or email me if you still have questions. So, Joe, take it away.
Thank you so much, Jerry, for the background and all the details around Medi-Cal. We really wanted to honor this really specific learning objective around the health needs, the continuing health needs of LGBTQ plus populations. And so, did you know there are some really interesting statistics here? 1 in 5 transgender people rely on Medicaid nationally, and in California, it's been documented that 28% of transgender adults were enrolled in Medi-Cal. And so we know that the number is likely larger, but this is what has been collected through research. And according to the Kaiser Family Foundation, 40% of non-elderly adults living with HIV in the country, for 40% of non-elderly adults, Medicaid is the largest source of insurance coverage. And many mental health services that benefit LGBTQ populations do rely on federal funding, such as HRSA, the Health Resources and Services Administration, and SAMHSA, which is focused on mental health, the Agency for Mental Health. And we just wanted to highlight here some of the potential implications for LGBTQ plus healthcare benefits. On the left-hand side of the screen, you'll see that for Medi-Cal benefits for LGBTQ plus populations, and this was a really great question that was asked earlier, currently, we do have comprehensive gender affirming care that's offered. It's a medically necessary type of service for members of all gender identities. So this includes hormone therapy and various gender affirming procedures, and coverage for services such as voice therapy when clinically indicated. And we also know that there are various primary and mental health care services, including transgender specific health needs and behavioral health services. And lastly, there's PrEP. PrEP for HIV prevention is covered by Medi-Cal without cost sharing or prior authorization, and the ancillary services such as screening and monitoring are also included. Now, what does this mean when HR 1 goes into effect? The proposed HR 1 proposes changes that could cut federal funding for gender affirming care and remove gender transition procedures as an essential health benefit under the ACA effective 2027. So this is really, I think, I mean, there's so many services around this. I mean, things like, puberty blockers, hormone therapy, surgeries. So this is a major cut for transgender members relying on these essential services. And we do know that with the impacts of eligibility, primary mental health care access could be reduced. And so the increased frequency of re-enrollment, the increased uninsured rates, and that'll lead to limited access to care. In terms of PrEP, there's some indirect risks associated, given the impacts of HR 1. So we do predict that there will be reduced kind of PrEP access points for LGBTQ and higher risk populations. So the key takeaways here are that this bill, it's a really big kind of bad, ugly bill in our perspective. There are deep cuts to Medicaid. And so with new eligibility hurdles and with these restrictions that target reproductive healthcare providers, and we do see this as a direct threat. So this is something that we want everyone to be mindful of. So I hope this information was helpful. And hopefully, I think it was James who really asked that really great question, if gender affirming healthcare will continue to be covered by Medi-Cal. It is currently being covered, but I think effective 2027, there's a proposed cut. So we want to let everyone know about that. I want to acknowledge that we are at time. We are actually 2 minutes over. So thank you so much for your participation in this webinar. We want to take a moment and ask everyone to click on the SurveyMonkey link. If you open the chat box and click on the SurveyMonkey link, there are 4 brief questions that we'd love to ask you. How was today's training for you? We'd love to hear your rating here. How confident are you in describing the public benefits and eligibility requirements for Magi and non-Magi Medi-Cal and identifying the enrollment steps? So your level of confidence is really important for us to know. And as a result of this webinar, how has your understanding changed regarding your knowledge of Medi-Cal eligibility and benefits, coverage opportunities, and policy changes that directly impact LGBTQ plus populations? So we'd really love to understand your change in knowledge, as this will help indicate how we can improve our trainings. And we also welcome any questions that you might have or suggestions that you might have to improve today's training, as we're always aiming to deliver the highest quality training. And coming soon your way, more webinar trainings will come your way in the coming next 6 months, depending on your feedback. And here's Jerry's contact. It's jerry@communityhealthsynergy.com. If we could give a round of applause for the fabulous Jerry. She's our senior consultant and expert. So thank you, Jerry. We appreciate you so
Thank
much.
you all. Thank you for the participation.